So first coming to the hypothalamus. In the hypothalamus is the one which is giving all the impulses to the pituitary. Hypothalamus is not only involved in endocrine system, it is also called as the head ganglion of CNS. From here only the autonomic nervous system comes in, head ganglion of CNS. From here the autonomic nervous system, that is the sympathetic and parasympathetic system, comes in. But today we will be discussing about their endocrinological functions. It usually gives impulses to two parts of the pituitary. We have the anterior pituitary. So pituitary has two lobes, that is the anterior pituitary and the posterior pituitary. So both these lobes are supplied by the or connected with the hypothalamus. From the hypothalamus, whatever is information is coming, that will be carried out by these group of pituitary. First coming to the posterior pituitary. The posterior pituitary will be supplied with the neurons directly by the neurons of the hypothalamus. The two nuclei which are located are supraoptic and paraventricular. Both the supraoptic and paraventricular are the ones which is giving their neuronal input directly to the posterior pituitary. Whereas for the anterior pituitary, it comes from the arcuate nuclei, primarily the arcuate nuclei, and not only that, it also comes from the other nuclei. But in the anterior pituitary, as you can see here, the hormones are transmitted in the portal vessels. So how does this happen? So any hormone produced by the hypothalamus which is reaching the anterior pituitary, they will be transported inside these portal vessels. There is no direct connections like that of the posterior pituitary. The posterior pituitary, it's like the entire neuron is extending till the posterior pituitary. So whenever you talk about hypothalamus, the hormones which are called as the posterior pituitary hormones are not actually produced by the posterior pituitary. The hypothalamus is the one which is producing the posterior pituitary hormones. What are the two hormones produced by the hypothalamus? They are ADH. What is this ADH? It is antidiuretic hormone. And what is the second one? Second one is oxytocin. Oxytocin. So both of this is produced by the hypothalamus, whereas it is secreted by the pituitary. Don't get confused. The pituitary is not producing them. It is storing them and it is secreting them. So if the question is asked, oxytocin is produced by which part? It is the hypothalamus. It is produced in the hypothalamus. Later on, the neurons come here and they are stored in the posterior pituitary and further secreted. So whenever you talk about hypothalamus, we have to discuss about these two hormones because they are produced by hypothalamus. So for primarily, we'll start with the anterior diuretic hormone. Anterior diuretic hormone, as the name suggests, it is preventing diuresis. What is diuresis? Sending out more and more water in the urine. Antidiuretic. So it is preventing the diuresis. It is also called as, this is also called as vasopressin. Vasopressin because it is said to have some vasopressin effect or vasoconstrictor effect. And it is called as arginine vasopressin. So what is the primary function? Antidiuresis, we said. It is through the reabsorption of water. But how does it do? It does by inserting the aquaporins. What are aquaporins? Aquaporins are nothing but the water channels. They will go and insert this water channels and from there it will be reabsorbed. They insert this in the CD and CT. What is this? This is the collecting duct and collecting tubule. So both the collecting duct and collecting tubule, this what aquaporins are inserted. Once they are inserted, what will happen? They will reabsorb, increase the water reabsorption. But if there is no functional defect in this water reabsorption, then we will end up with a specific disease called as diabetes insipidus. It is not mellitus, it is insipidus. Diabetes insipidus, what is the issue? Here there is not glucose excess, here there is excessive water loss. The person is constantly losing water and this is called as diabetes insipidus. And diabetes insipidus can be of two types. Both are important. The central one is called as the central diabetes insipidus. What do you understand by central? Central means the problem is with the higher centers. So here the problem is with the hypothalamus and there is decreased production of antidiuretic hormone. Whenever antidiuretic hormone itself is decreased, what we are going to do? Ultimately, they will land up in diabetes insipidus. And what is the treatment for this? This has been asked. What is the treatment? We have to give vasopressin. There is a pharmacological form of vasopressin which we give it, that is called as desmopressin. And there is another disease called as the peripheral diabetes insipidus. If central is there, the another one will be peripheral diabetes insipidus. In peripheral diabetes insipidus, what is the problem? Here there is insensitive to the ADH. Here ADH is present, but the receptors are insensitive. Receptors are insensitive. So is there any use in giving ADH here or vasopressin here? There is no use. The drug used here is thiazide. It is very astonishing that thiazide is a diuretic, but if it is given constantly, what it does is it helps in reabsorption of water. So thiazide diuretics have been given for these patients to treat peripheral diabetes insipidus. So what is the presentation? So ultimately there will be one presentation where there is huge amount of water loss. This water loss will lead on to hypovolemia. So hypovolemia will present with hypotension. The water is moving out from the urine. So what will happen to the osmolality of the urine? It is now having more of water, less of solutes. So what will happen? The urine osmolality will reduce. There is a reduction in urine osmolality. But in the plasma, now water is being sent out. In the plasma, what will happen? The plasma osmolarity will be increasing. There will be clues in the question with all this thing. Hypotension, decrease in urinary osmolarity and increase in plasma osmolarity. So this can be the clues. This is all about our antidiuretic hormone. Now coming to the second hormone which is produced by the hypothalamus, that is oxytocin. Oxytocin is a very famous hormone. All of us know its functions. First, what it does in the breast tissue, what it does in the uterus, and what it does in the corpus luteum. It acts in three places. First, coming to the breast tissue, in the breast tissue, it can contract the myoepithelial cells. It can cause contraction of myoepithelial cells. So, if the myoepithelial cells are contracted, what will happen? The milk that is already produced can be ejected out. So, it is helpful in milk ejection reflex. And all of us know this milk ejection reflex is what type of feedback? Yes, it is a type of positive feedback mechanism. Positive feedback mechanism, because we have seen it in a general physiology. Now coming to the uterus. In uterus, its function is happening during fertilization also and during parturition also. Parturition, all of us know oxytocin increases the contraction of uterus. Increases the contraction of uterus. And this leads to expulsion of the fetus. Expulsion of fetus. It is helpful during fertilization also. How does it help? There are some minimal contraction of the uterus in an upward direction during fertilization. Minimal contraction of uterus which is happening in an upward direction. That will help the sperm to be sent to the uterine cavity. So the sperm can be moved inside uterine cavity, moved in. So that is what happens with the fertilization. And during parturition, it is expulsion of the fetus. And especially this hormone, that is the oxytocin, is under the influence of two things. There is an estrogen which is stimulating this oxytocin, and there is progesterone which is inhibiting this oxytocin. So that is the reason why progesterone is called as pregnancy maintaining hormone, because during the pregnancy we don't want the uterus to contract. We want it to contract only during the parturition. That's why progesterone levels are very high during the pregnancy time, and it inhibits the oxytocin and keeps it under control for a longer time. And the final function of oxytocin is the corpus luteum. What does it do in the corpus luteum? In the corpus luteum, it is going to cause luteolysis. It is causing luteolysis. So these are all the functions of oxytocin. So we have discussed the two hormones of hypothalamus. One is the ADH, another one is oxytocin.